So I will call this meeting to order. It is 9:32 a.m. We have a quorum. Let's start off with doing some really quick introductions. So we'll start with the folks in the room. So if you all want to introduce yourself, and then we'll go to our virtual attendees.
So I can start. This is Melissa Martz with the Pikes Peak Area Agency on Aging, and I'll go to my right.
Good morning, Mary Wagner, Cripple Creek Transit.
Aaron Cimarrero, Silver Key Senior Services, Director of Transportation.
Valerie Anders with Silver Key.
And then I'm in the room as well, Jared Werner with PPAAA.
Wonderful. Well, good morning, everyone. All right, and then we will move to our individuals on the virtual side. So Diana, do you want to start us off?
Good morning, Diana Van Auken, Teller Senior Coalition, and Ronnie Gordon is also here virtually. She just tied up right now. Thank you.
Thank you. Good morning, Jared. You already said. Laura.
So this is Melissa. Laura is kind of feeling under the weather, but it looks like she might try to speak. I know she has some things to share today, so she probably will want to talk at some point, but I'll just go ahead and say that Laura is here, and then she can save her voice for when it's important.
Sounds like a plan. Paul.
Good morning. This is Paul from the Independence Center.
Good morning. And then Rosa.
Good morning. This is Rosa with the City of Fountain.
Fantastic. Well, welcome everybody. Good morning. All right. So consent items. Approval of minutes.
Deanna?
Yes, ma'am.
I'm just going to jump in for 1 second because Jacob did come on too. So.
Oh, wonderful. Oh, cool. Excellent. Jacob, would you like to introduce yourself this morning?
Sure. It was really dark on my screen. Good morning, everyone. Jacob Matson. I am the planning supervisor with Mountain Metro Transit.
Wonderful. Good morning. All right. So we will move on to the agenda approval. Do I have a motion to approve the agenda as it currently sits?
Diana Van Auken, Teller Senior Coalition. I move to approve the agenda.
Thank you. And do I have a second?
Rosa with the City of Fountain, I second.
Thank you. All right, so I have a motion and a second to approve the agenda as it currently sits. All those in favor of approval of the agenda say aye. Aye.
Aye.
Wonderful. Any opposed? Okay, seeing nor hearing no opposition for the agenda as it currently sits, the agenda is then moved and approved as it currently stands. All right. Yay. Consent items. Approval of minutes from the January meeting. Do I have a motion to approve those minutes as it currently sits?
So moved by Val with Silver Key.
Thank you. And do I have a second?
Seconded, Diana Van Auken.
Wonderful. All right. So I have a motion and a second to approve the minutes from the January meeting. All those in favor say aye.
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 All those, anybody opposed? All right, seeing nor hearing no opposition to the approval of the January minutes, we will move to approve. All right. Fantastic. Okay, so public comments. Jared, do we have any public comments?
So I will ask anyone who is online to please use the raise hand function if they would like to provide public comment. While we're waiting for any of that, I will let you know that we do not have anybody in the room outside of board members and staff, and that we did not receive any advance requests for public comment, and we did not receive any written submitted public comment that we would distribute it to the committee in advance. As I've gone through all that, I do not see any hands raised. So Madam Chair, I think we can move forward at your discretion.
All right, fantastic. Well, thank you for all of that. All right, I think we can move on to action items. And it looks like we've got the 2024 officers. Ooh, I lost them. Okay, here we go. The 2024.
I apologize. Those are the minutes from
Oh,
the
from
last
last
meeting.
year. From last
And
January.
I had not moved it up. I apologize for that.
I know, it's okay. It's totally fine. I'm like, I thought we talked about all of this. Okay. But you know, you never know. Sometimes agendas change, and that's totally fine. So it doesn't look like we have then any action items. Any membership appointments? I don't believe so at this time. No? Okay. Community guest or provider presentations? Okay. All right. And then we have item number 8, training, information sharing, coordination opportunities. All right. So we've got two pieces here. We've got the debrief for the specialized transit plan community meetings and reviewing a legislation on transportation and transit. The debrief of the specialized transit community meetings, would you like me to start us off? And then Laura, do you want to chime in?
Yes, that would be good.
Okay, fantastic. I can absolutely do that. All right. So the specialized I haven't had any coffee this morning. Specialized transit plan community meetings. So I participated, and Laura and several people here in the virtual and real space participated in a meeting on the 21st. This was part of the long range transportation plan that takes us out to 2050. The LRTP, or the long range transportation plan, is building a complete set of specialized transit needs for the region. There have been focus groups held with the Independence Center, educational institutions such as D11, Health and Human Services, and businesses. So far, there's been launching of the website, a digital engagement survey, 2 regional transportation planning advisory committee presentations, 6 stakeholder interviews, and then the focus groups, as I mentioned earlier. The model of the coordination continuum was discussed. This continuum begins with communication and then follows through to coordination, collaboration, and finally consolidation within the transportation space. And the strategy categories that were broken into vehicles, people, programs and services, infrastructure, and policies. And then the next steps for the long-range transportation plan meetings will be to talk about needs and strategic development, emergency responses, and outreach and engagement. Am I missing any kind of high-level overview pieces? It was a very robust and lovely conversation. We were able to really kind of unpack some of the goals of the transportation providers who were present at that meeting and other things that were mentioned within the focus groups and the stakeholder engagement interviews. I know that there are several people both in the room and in the virtual space who are also in attendance. Is there anything else you would like to add to support what I might have left off, or things that you think need to be kind of amplified in that space? Okay.
I have a question to throw out there. I'd just like to know some kind of feedback from folks of how they felt like the meeting was went. Sorry, I'm a little off today. How they thought the meeting went, and we do have a follow-up meeting to talk about more of from the perspective of here's some suggestions from the consultant team of how we may be able to tackle some of our challenges as a group. And so just wanted some feedback within this group of how that meeting went and how could the next meeting be better so that I can convey that to our consultant team.
So Laura, Aaron from Silver Key, I really think we did a great job of nailing the problem set. And we did throw a bunch of resolutions, potential resolutions out there. I think really drilling down on those resolutions, seeking collaboration to implement and then start to assess those resolutions so that we can actually get after the problem set that is well identified. I'd like to see that happen. I'm still kind of new. I'm on the outside looking in, but it definitely is, it's definitely, we're moving in the right direction.
Great. Thanks, Aaron.
Laura, this is Val with Silver Key. I would say, from my point of view, it would be helpful if we had some other providers besides just the providers of transportation, like some of the places we're taking people to and their experience with specialized transportation, like the hospital and medical and skilled facilities and assisted livings. Those individuals that are in those settings and need help from us, it would be helpful just to have their point of view too.
Great. I think we had several folks from those types of groups in attendance of a focus group meeting, but I think now that we're stepping into solutions, it may be worth bringing folks in based upon your suggestion to be a part of that solution piece of it.
And Val, when you bring that up and those entities, do you have any idea, like the staff person that should be invited? You know, like when you think about the hospitals, when you think about like the dialysis clinics, you know, our assisted livings, skilled nursing, who are some of this? What is the role of the person maybe that we could reach out to there? I mean, kind of drawing a blank right now.
In nursing homes, you probably would start with the administrator or the executive director, same with assisted living, or even, I don't know if they have some associations that could like represent the whole, possibly even senior housing. That would be interesting that, you know, some of these, and I don't know that they have an association, but.
They have resident councils.
Yes. Yes.
So that's interesting.
That would be interesting.
Okay.
And to add to that, I think schedulers. So anybody, and that's why administrators, I think, are key. So schedulers, because if we take from what Sharon King said to us at that meeting, she wanted our systems to flex around the medical systems, not the other way around. And it's a great point, because if a medical system gives them an appointment 3 days out, most likely our specialized transportation system can't meet that need, right? We need that 21-day, 14-day advance, or they have to be pretty close to those providers in order for us to get them there. So.
I feel like with the dialysis units and even the hospital, like the first thing I think of is like a social worker kind of person, but I don't know if that's the right person or not. But again, maybe it would be an opportunity to ask that person and then they could say, oh, maybe this would be better. And it's interesting to think about the people who oversee scheduling in those large, you know, businesses to have that. So that's interesting.
And in the large hospitals now, a lot of physician offices are within the hospital. And so we have to coordinate getting them to the hospital, up to 6th floor, to the, you know, doctor's office. If they can't manage it by themselves, we're taking them all the way. And then when they come back and we have to pick them up, there's always this, where are they? Did they come down or are they still upstairs? So there's a lot of coordination, and depending on their ability, I'm sure it's challenging for our drivers.
Most definitely. So that is, it's almost, I hate to put it this way, but where's Waldo, right? So is the patient on the third floor, the customer, our members, are they on the third floor? Are they on the sixth floor? If we didn't do a good job at reservations, where it could take time away from that next pickup, that next drop off, because we are searching.
Great, this is great feedback. I think I saw Diana come off mute. Diana, do you have anything to share?
I was just going to say, we work a lot with the hospital discharge planners, who's usually a social worker. And so highly recommend that they be included also.
The other one that we work closely with is the valet systems within the hospital. And we've had some struggles there where they won't let us park in the certain areas because we may be there too long and we need to, so we've had some issues around the valet.
Great. I'll take this back to our consultant team and just try to figure out sort of the best way to tackle these conversations, whether this is the next conversation that we have with folks or a follow-up conversation in terms of how we approach this. So I appreciate everybody's participation last week in all the meetings. I know we tied up a lot of people's time, but it was helpful for us and helpful for the consultant team to kind of hear straight from you guys what is going on in your world. So appreciate that.
Laura, I had one other comment. This is Val
Okay.
again, is that possibly it would be helpful if we included some funders, maybe some funders that we're not currently funding, like with Medicare Advantage programs, those type of things, because we influence healthcare, and if they're going to receive quality healthcare, we have to get them there. So maybe we could get some of them on board to pilot some programs where they're paying specialized transportation to get clients to their doctor's appointments before they end up in the ER.
That's a great suggestion.
Hey, Laura, Jacob here. Do you think it'd be helpful if we got a list to this group, to the MCC here, of those that were included in the focus group? So kind of an idea, show who was actually consulted, maybe just by organization, maybe along with job title, but more importantly by organization. Do you think that'd be something helpful for the group here?
Yeah, I was actually going to make that suggestion, and I can get that list out to the group. I think that would be helpful. And a lot of folks were invited, and we might not have had the right people on our list from those organizations, but we did have quite a good representation from several of these groups that y'all have mentioned today.
Anything else? Anybody else would like to add? I thought it was a really great conversation. I wish it had lasted a little bit longer. I felt like people still had things left to say. So that would just be my 2 cents. And then to kind of piggyback on what Erin said earlier, I love implementation and action pieces. So kind of fleshing some of those things out a little bit more is always very helpful for me. So we have these ideas, and then what are some possible solutions that we can really kind of start to sink our teeth into and very quickly figure out, like, oh, that's absolutely never going to work. Or yeah, you know what, that actually has some legs and a possibility of being operationalized. So that would just be my own thoughts on those pieces.
This is Melissa, and I'd like to kind of add in terms of next steps and pieces to kind of hold for a future conversation and action item is, once this is kind of done, it would be great to have a more formal presentation done to elected officials. I think that when Val brought up the idea of, potentially impacting and having conversations with Medicare, also Medicaid, that's where some elected official discussions could come into play. And I think that, oftentimes we get the plan done and then it kind of sits on the shelf. We all kind of know in the back of our minds that, there were activities that were getting worked on, identified in the plan, but yet it really doesn't have an opportunity to kind of continue the messaging right after it gets done. And yes, the PPACG board has a lot of local jurisdictions with elected officials present in the room, which is good. And they do see the long range plan, but they got a lot of things on their mind. And so as I'm sitting here reflecting on this, I'm just thinking about being a little bit more proactive when this is over and having maybe a little bit more intimate conversations with the PPACG board, but then also working to, communicate messages up to state officials that should be aware of the conversations that are happening in the long range plan. So I just have that on my note with another asterisk and star by it for make sure you revisit this in 6 months and have we done it or not. So anyway.
Wonderful. Anything else anyone would like to add on this item? No? Okay. All right. So moving on to 8B, review legislation on transportation and transit. So I believe that this is my item. So I will just say that as I look over the upcoming bills that are being put forth by our legislators, it occurs to me that there are a lot of different pieces and a lot of moving parts. Some of them are related to ozone and ozone emissions, covering both non-commercial and commercial vehicles. There are conversations being held about pedestrian safety, about vulnerable users, which includes older adults, people with disabilities, people who use bicycles or scooters. There are conversations about parking. There are conversations about increasing budget for CDOT for another $5 million. So they want to add another $5 million to CDOT's budget, which is interesting, and thinking about the implications of that in terms of funding streams. So all that to say is that I would highly encourage you to look at the legislative calendars. It's pretty readily published. If you have difficulty finding those pieces, feel free to send me an email. I would be happy to walk you through that. But to talk to your representatives, send them an email, pick up the phone. They're always happy to hear from their constituents about pieces of policy that you find that may be challenging, that are really exciting to you, that you as a private citizen really want to support. And also, PPACG has a very robust legislative component to it. So if you have specific questions or specific concerns, feel free to bring them to that specific entity and group. They meet on Mondays. Is that accurate? Can somebody tell me when they meet?
This is a chair. They meet Mondays at 8:30.
Okay.
Yeah.
Fantastic. So yeah, so especially during the legislative session, which is in Colorado 120 days, I believe, they are meeting on a regular cadence. So feel free to reach out to them with any concerns or questions, because these things do impact us. They impact the way that we're able to deliver services. They impact our customers and their experience in the transit space. They impact funding streams. And so having those conversations is really, really important. Any questions? Yes, Laura.
Sorry, I had to hop off for a minute. Did you guys get it into the individual bills that are out there right now?
I have not as of yet, but I am certainly happy to talk about some of them. So there are a couple of Senate bills. There's one specifically about remuneration placards for individuals with disabilities. So this came out of a piece of legislation that was started several years ago. And the way that the Department of Motor Vehicles has interpreted it was that they could only give people either one placard and one plate. Well, if you had motor difficulties or challenges kind of putting the placard on your rear view mirror, this was problematic. So this specific bill really looks at redressing that issue so that individuals with disabilities who also have these other meeting qualifications would be exempt from parking meters. So that's one piece of legislation. There's a conversation about a statewide transit pass. And I think, Laura, you and I had talked about this. They're wanting to visit a system whereby they've got one statewide pass. And so there are many conversations going around, again, around the implementation space of like, well, what would this really look like? How would this impact providers? And so there is a Senate bill, Senate Bill 24036, as I was saying earlier, about vulnerable road user protections. So this would really be looking at, as I said, pedestrians, people who use wheelchairs as mobility devices, people who ride bikes and scooters, and looking at that traffic safety implication, because again, we want to kind of reduce the amount of fatalities and injuries that are occurring on the roads at any given time. So those were some of the big ones that I was thinking about. And then of course, the big funding bill that I saw last night, which was interesting, for another $5 million for CDOT. Can you think of anything else, Laura, that I'm missing?
Yeah, so there's actually a new bill that's out that we're watching. Is the Transit-Oriented Communities Bill.
Oh, yes. That's
this
tied to housing. Yeah, that's very interesting. I was reading over that last night. Yeah.
Yeah, so this is kind of more applicable to MMT, but essentially it's the transit-oriented community is actually a designation, and essentially it's centered around transit and housing goals and affordable housing around transit. And so currently many counties and cities are working towards trying to build housing around transit. However, this bill would essentially require municipalities to adopt this type of work. And essentially, they would have to set goals. Their goals, if they're not met, or if they don't meet the standards of the state, it would in turn end up where the municipalities would forfeit specific funds that they typically get. We're kind of concerned about this from many perspectives. While we like the concept of transit-oriented communities, the kind of backing behind this and issues around land use, already issues around things that have already been put in place. The fact that this is not a voluntary thing. This would be a mandated thing for municipalities, which would ultimately forfeit funds if they weren't able to adhere to the state's standards. These are always challenging types of bills for our municipalities here because we have such a diverse group of municipalities that we work with, and they all have different challenges that are unique to their communities, and one size fits all does not necessarily always work. So we're watching that bill in particular. Like I said, that one just came out. In terms of the statewide transit pass, CASTA has been working directly with the Senate sponsorship and Stephanie V. Hill in the House to help those sponsoring this understand sort of the operational challenges of what they are proposing. And so this this bill has been through several revisions, and ultimately I think it's something that's going to have traction. But fortunately, we have CASA at the Capitol there raising concerns and trying to help sort of put this together. So I think where it lands right now is a formation of a committee to figure out how this may work operationally. Um, I don't think that they are looking to roll out something like this should this pass until 2028, which seems right around the corner. So more to come on that, but that's another one that we're kind of watching. If y'all remember, Connect Colorado was an initiative, a CDOT that was presented a couple of years ago as a pilot program to connect all the mobile ticketing systems. In some of, I think they piloted it in the North Front Range area up by Fort Collins initially. And so Castor's proposing, instead of doing a statewide transit pass, looking to expand Connect Colorado. So hopefully there will be some interesting opportunities for this group, even though I know that most of you guys do not do mobile ticketing. How can we integrate human service transportation as well as traditional transit in an accessible way for folks to be able to navigate through a single portal. And I think that's what the intention of this bill is. But I think that also we have to be at the table for some of these discussions in terms of operational challenges. So like I said, more to come on that. I've been talking back and forth with Ann for quite some time about this bill. So the more updates that I get, the more I'll share.
Great. Thank you so much for that. And along the lines of the transit-oriented communities, there was also some interesting language regarding housing density that raised some interesting questions for me in terms of how many units did they want to put on 1 acre of land, and you know, how all of these components had to be connected. Yes, Jacob.
So yeah, Laura, first off, good job on the explanation. A little bit additional information on the transit-oriented community. So I have at least the draft, the most recent draft that I have available of the bill in front of me, and just wanted to also kind of iterate that Laura mentioned about the lack of funding. So that's actually or what happens is if you don't meet certain goals, you forfeit funding, and that would be the highway users tax fund money is what comes out of that. And that rolls over into a grant program that then transit systems can compete for to go for infrastructure related grants to improve their facilities. So that's kind of where that money goes. It just doesn't get sapped up by the state. It rolls over into a grant fund that they would then administer and put out grants for. So aside from that, that's all I had. Thanks.
Jacob, this is Melissa. And I know that when we were talking here in Colorado Springs about, you know, rebuilding our transit hub, there were conversations about making it a transit-oriented community in and around wherever the hub ended up landing. And do you have any updates or anything on the hub and kind of where things have gone with all that you can share?
Are you talking about any specific area in terms of a hub?
She's
No, because
talking
it's been
about the transit center, the new transit center study that you guys completed, I think last year.
So there's a lot of information there, unfortunately, is kind of tied up in litigation that I can't, and not like suing litigation,
Okay.
but a lot of stuff I can't really comment on. It's not open or knowledge out there yet, so I really can't give any specific update on that. I can say in a more kind of global general sense that as we're updating the regional transit plan, these are some of the conversations that work their way into that plan. While that plan is not specifically going to say, hey, develop this transit oriented community here with the bus line going here and these connections being had. It doesn't usually go to that necessarily that level of depth, but it does kind of scratch the surface on some of those potential opportunities. So in the future, when we look to, or if we look to do a more transit oriented development along those lines, we would have that opportunity to go and apply for grants and go for projects, and then also be included within the LRTP as well as along with those. But that's kind of getting a little bit more into the weeds of it. But in a general sense, yes, those are things that we look at from the regional transit plan.
Thanks.
Anything else?
So this is Aaron from Silver Key. This is kind of just a question and clarification, and maybe for Laura or Jacob. So if it's a transit-oriented community, it has to be on an existing bus line or 3/4 away from an existing bus line in order not to lose the funding?
So there were certain parameters within the draft bill. This bill has not been passed yet. Within the draft that we had looked at are within 15-minute frequency. 15-minute or better frequency, if I recall correctly, was one of the things we looked at and kind of what falls on that. And so for development within those areas, that's where you would need to have certain densities and transit options available. Otherwise, potentially losing that that funding.
And then I
Yeah,
guess follow up. Oh, go ahead. Sorry, Laura.
the funding would essentially be lost for communities that couldn't comply with the or didn't have set goals and also couldn't comply to those goals that they had to submit to CDOT. So while I think while Jacob was mentioning that, yes, it would allow transit agencies to access those funds. It would still um, come with the deal. I would say come with the deal that those communities would have to adhere to the new standards in order to receive those funds and for those transit agencies to receive those funds. So essentially, if you didn't meet that criteria and those goals, those funds would go to an agency or to a municipality or transit agency that was able to meet those goals.
Understood. So is specialized transportation a part of the solution?
That's a good question. And that's sort of one of these things that when these types of conversations come up in the legislature, they often only focus on our fixed route and paratransit services. And so I think it's important for this group, as well as us, to remind folks that a true transit-oriented community also includes specialized transportation. And so I think that I'm glad you said that, Aaron, because that's something that I'd like to share with CASTA as they're kind of thinking through this. I mean, our hope is that this will be something that will be voluntary for our municipalities to participate in. But ultimately, we don't know how this is going to shake out. But that is a good point that we should include that in sort of the definition of a transit-oriented community.
Thank you, guys.
Wonderful. Anything else? Okay. All right. So all of that to say, please stay involved. It does matter. If you have any questions on where to find information or how to track down a bill, or, you know, how to find and contact your legislator about these pieces, feel free to outreach. I am always happy to kind of walk you through a quick tutorial on where to find information. So I think that's it for those items. All right, items for the next meeting. Are there anything that we would like to put on the discussion? It sounds like potentially revisiting some of the specialized transit plan might be in order. Anything else people would like to put on the agenda for the next meeting?
So this probably doesn't really need to go on the agenda for the next meeting, though maybe it should. So we have our spring service change out right now for 2024 in terms of what we're looking to change up. Not a lot of massive changes, just a kind of a quick overview of what we're doing. Our Route 18, which currently ends on the south end at Boulder and Bonfoy, we are proposing to extend that down to Eastlake and Union. So it would go a couple more miles south there. And there's a senior high rise that the bus would service. This would also involve connecting Route 18, better connections with routes 1 and 7. So we'd have kind of more of those east-west connections hitting north and south as well. This does put the Route 18 from 45-minute to 1-hour frequency to pull this off. But it does match up with those routes, so there's additional connections there. That is one of our proposed changes. Another one, minor one, we on our deviated fixed route for our Route 38. Currently, there's really only stops in the Montebello area on the south, and then up on the north area near the Memorial Hospital, Memorial North. We're looking to include 2 additional stops, well, 1 in each direction, north and southbound in the Dublin area, Dublin and Union, to offer more connections for those that want to use fixed route. So that is also out there as a proposal. And then finally, we had put this out last year in terms of our spring service change for 2023 to extend an additional 2 hours of service on the 4th of July. So for this proposal, we're actually looking to no longer do that as part of our operation. There's a lot of operational issues, concerns, and just having driver availability for the next day. And to put in perspective, this last year last year over the 4th, we actually were not able to extend the service anyways with the number of drivers that we had. Even with the full staff, that can prove difficult to more or less concerning that we would not be able to make all of our pullouts for the next morning with the amount of drivers that we have. So we're looking to no longer offer that. Like I said, we never really did in the first place. It's also worth noting that we do see a noticeable drop in ridership on the 4th as compared to the other weekdays around it. So there is less ridership on that day as well. So those are our proposed changes. It's all for public comment right now. Today is actually the last day for public comment on those. We're going to take all the comments, look back, see if we need to make any adjustments or tweaks to that. And then we'll have a final one out there, change in the next month or so. And I don't know if that'll come up in the next meeting, but if it does, if everything's done in time, I will make another announcement, whether or not it's been approved or changes have been made. So I'll give my own update again next month for that. Thank you.
Sounds good. All right. Well, and then that kind of kicks off into the information sharing section. So I will leave some time for folks to kind of share out any information, any things that are coming up for them and their organization.
Deanna,
yes. Go ahead.
One of the things that I forgot to mention before was CDOT sent out their super call for capital projects. So I just wanted to make for sure everybody was aware of that. I think I sent that, forwarded that on to the MCC group. So that is out there. I know it's kind of crazy given that some folks are still waiting on for their current capital projects to be fulfilled. So, but that is out there.
Laura, I can give you an update. We received our contract for our 6 used vehicles today. So Jason
Awesome.
is signing it. So MMOF is in the works.
Awesome.
Anyone else in the room would like to give some information sharing or updates? And then we'll popcorn it over to our virtual attendees.
Hi, Rosa with the City of Fountain. I just want to say March 18th, the week of March 18th is National Transit Driver Appreciation Week. So we will be celebrating that that week.
Wonderful. That's awesome. Anyone else like to share? I see Chelsea and Mark have joined us online. Do you all have anything you'd like to share with the group?
Hey everyone, this is Chelsea. No specific updates. We are just deep in our data gathering for our annual State of Downtown report. So that's what we're working on right now.
Wonderful. Mark, do you have anything you'd like to share with the group? Diana, any updates from you?
Not really any big updates. We are getting another transit van through our MMOF funding. So we'll be getting that in mid-March. So we're excited about that. The transit vans now have all-wheel drive, and that's made a huge difference up here for us, especially with all the snow lately. So we're excited about that. And that's about it.
Outstanding. Congratulations.
Thank you.
Paul, any updates from the Independence Center?
No, not really. Everything's same old, same old.
Okie dokie. Sagan. Sorry, Sagan, do you have any updates? Anything you'd like to share?
She did put something in the chat just a second ago, Deanna, but
Oh,
I didn't get to
fantastic.
read it. I think it said no updates at this time. Okay.
Yeah. No, not at this time. Thank you. Okay, fantastic. All right. All right. I believe we have everybody and everybody's updates. We have any other items that folks would like to put on the agenda for a next meeting? No? Okay. Seeing nor hearing none. All right. Any last call, any last things that folks would like to bring up before we adjourn for the morning? No? Okay. All right. Well, then we will adjourn for the rest of the morning. We will see you all back here in March. It is 10:20. Have a lovely rest of your day. Stay warm as it gets precipitously colder out there. Thank you, everyone, and we'll see you next time. Take care.